So the very foundational conceptual structure of the DSM doesn't make any sense at all. Now, the DSM, all of it is culturally determined. Take dependent personality disorder, for instance, for people who are supposedly too dependent. There's no independent personality disorder. Why is that? Well, in our culture, we value independence. It's a good thing. Dependency is a bad thing. Other cultures, dependency, what they call disparagingly dependency, is a good thing. And independence, being that separate, is bad. Okay? So the whole DSM is just a commentary on what a group of people think deviates substantially from the current cultural norm. Okay? Now, the point from this section that I'm trying to get across to you is you can't have a diagnostic system unless you have firm definitions of normality, which the DSM does not have. Another point I'd like to make to you is that as a counselor, I'm proud to highly value diversity. And I think you are too. But think about if you can value diversity and at the same time value a manual that pathologizes deviations from cultural standards. Think about how those two fit together for you. Okay? They don't fit together for me at all. Okay? Now, the conclusions I have from these first 2 points is that the DSM is not a good measurement instrument. Therefore, we're not justified in giving people diagnosis based on it. And diagnosis can be very stigmatizing and life-changing. So we're not justified in giving people these stigmatizing and life-changing labels based on the quantitative elements of the DSM. Plus, there's no basis for claiming that the DSM is a diagnostic manual at all. Okay? Now, even with these problems, Phil might say something like, the DSM is the best we have. It's not perfect, but it's good enough. It's the best we have. I'd like to address that point now in terms of the utility for the DSM for counselors. Okay? And it's important to remember that nothing is good. Okay? Things are good for. Okay? So is a hammer good? Is the latest state-of-the-art hammer good? It's good for carpenters. It's not good for mathematicians, though. Right? So we have to think good for. Is the periodic table of elements good? Certainly it's good. Is it the most highly evolved thing we have in that area? Of course. Is it good for architects? No. Is it good for counselors? No. It's good for chemists. So we have to ask the question, is the DSM, a psychiatric document developed by psychiatrists, good for this other profession called counseling to adopt? Okay. Now, it is good for one thing. And Phil's right about this. It's good for getting us paid. Right? Unquestionably, the entire reimbursement system is structured according to the DSM. So it is good for getting us paid. But just because it's good for getting us paid, and the reimbursement system is structured according to it, that doesn't mean it's good for our clinical work necessarily, right? So, is it good, the DSM, for helping clients and guiding counseling? Okay. To answer that question, we have to ask another. And that question is, what is it that makes counseling effective? What is it that makes counseling work? If the DSM is supportive of that thing, I guess we'd have to conclude it's good for counseling. If the DSM isn't supportive of that thing, we'd have to say, well, it isn't good for counseling. Okay. Fortunately, we know the answer to what makes counseling work, what makes it effective. We know it from over 40 years of counseling outcome studies, and that is the relationship between the counselor and the client. That's the variable that's associated most highly with counseling outcomes, unquestionably. So if the DSM and categorical systems are good for promoting relationships, then it would be a good thing, right? Okay. Well, let's think about relationships. We don't have to just think about counseling relationships. Let's think about everyday ones. Supposing you have a friend who comes to you very distressed because of a bad day at work, and the friend is upset and needs to talk. and you tell the friend, I think your anger problem's acting up. Now, you apply a categorical descriptor to the problem. Remember, is that a bonding experience for you and your friend? Are the two of you brought closer?
I don't think so.
I don't think so either. In fact, trying to understand that person's unique position seems to me to be a bonding experience. Now, you could take the position that that's the way all relationships work, except in the counseling room. There's something special about that room that's completely different. In that room, categorical systems bring people closer together. Of course, that would be an absurd position to take, right? Relationships are relationships. Counseling is just one kind of them. Now, the DSM would also be good for counseling, conceivably, if certain treatments were aligned with certain disorders. Okay? Now, forgetting about the fact that the disorders aren't real disorders anyways and make no sense, supposing they did, if they were lined up with real treatments, that would make sense. And Phil seemed to kind of imply that that was the case. But I'm here to tell you it's not. That there are no pointers to counseling techniques in the DSM according to diagnosis. In fact, what we know is that techniques are not what help people generally in counseling. Okay? In fact, the most preeminent researcher of counseling outcomes, Bruce Wampold, after conducting an exhaustive meta-analysis of over 40 years of counseling outcome studies, concludes that less than 1% of counseling outcomes is due to techniques. So, the DSM can't help us out with relationships. It's a categorical system. Think about it. The DSM can't help us out with techniques because techniques is not how we help people. Okay? The DSM is good for getting us paid. So, the DSM is mostly useless for our purposes. And remember, it wasn't a document that was invented by us anyways. It's just something we've adopted to try to get paid. What I'm saying in conclusion is that the DSM is mostly useless and probably damaging because of the lousy measurement properties it has. Because it isn't really a diagnostic manual at all if there's no firm norms. And lastly, because counselors heal with relationships, and the DSM is a barrier to it. Thank you.
All right. Thank you, Dr. Hansen, for warning us about the dangers of the DSM. At this time, I would like to invite both of you to come up to the podium, and each of you will have 10 minutes to rebut the other's opinion. And Dr. O'Dwyer will start.
Thank you, Rebecca. So I suppose we will see on the course description for the DSM-4 a warning if my colleague has his way. There is a significant philosophic disagreement between Jim and I. I believe in an epistemology that is pragmatic. In my view, the idea or a diagnosis is logically established and supported by the data in the 5-volume document that underpins the DSM-4. There are hundreds of studies that are utilized in developing the criteria sets for each diagnostic category. So it is manifestly not correct to say that it is produced by a few psychiatrists in their ivory tower imposing their theories on us. But I am willing to concede that there are few entries in the DSM-4 that have minimal empirical support and are highly culturally driven. That limitation does not negate the validity and usefulness of the entire document, and neither does it lend credence to the argument that the essential features of a disorder cannot be delineated. Realists and pragmatists understand that it is more useful to describe what we can, as well as we can, than to remain in an undifferentiated world of vagueness, congratulating ourselves on possessing esoteric knowledge that eludes description. Of course, in such a comforting world, one is always right. No wonder payers have grown weary of paying for services that sound like mystical treatments. Now, there is a place for pastoral services, but of course they depend on faith for their efficacy. Perhaps that is what my opponent would like the field to embrace. But using the DSM-4 simply to get paid is a form of compliance with current professional standards that has a hollow ring. If one believes on ontological grounds that such diagnostic classifications are not possible or are even dangerous. An objective finding is something that is true or substantially true, independent of human thought. It is true that 2 + 2 is 4. A constructed truth may or may not be true. For instance, a painting is judged to be wonderful, is a subjective truth.